And if you look out in the literature, which I just did, since we just published a paper on this, nobody's targeting peripheral nerves on purpose. It's very interesting, and I don't necessarily know why, but a lot more people are focused on how to get across the blood-brain barrier, and a lot less people are concerned about peripheral nerves. But when you think about the sheer number of people with sciatica that could benefit, or pain medication that can work directly on your nerve that doesn't require the placement, surgical placement of a nerve block, we've got a lot of interest in this. So this was all with undergraduate students, which is also very cool. So an undergraduate student of mine, Kaylee Trumbull, she started working with me the summer after her freshman year. I added her to this project. We've been trying to work with Jeff to deliver this peptide. And I kind of told her, like, here's some different conjugation chemistry you can explore, but I want to try and come up with a nerve targeting peptide, and I want to test it in nerve injuries. And she, again, just kind of ran with it. She really thrived as an undergraduate student in that environment with that intellectual freedom. And then once we had developed the technology, we're ready to test it. We went to Jeff Twiss's lab at the University of South Carolina, and he taught us how to create sciatic nerve injuries in rats. And we started testing to see where our particles go after being injected intramuscularly. And what we found is that one of our targeting peptides allows for direct transport to the peripheral nerves, where the drug is retained in the injury site for 48 hours at least. We haven't tested for longer than 48 hours.